Alright guys, welcome back to my channel, and here we are with yet another video on the topic permanent mandibular canine. So let's begin with any further ado. Here we are going to learn about the different aspects of this tooth. So coming to the first aspect, that is the labial aspect, that is the front view of this tooth. What can we observe or see from this? What do we see? So here, if we see the mesial outline, okay, it's straight over here, and it is straight and it is in line with the mesial outline of the root. So it is in one line. But when you see in the distal side, this is a bit slightly convex. Okay, it's convex over here. And when you see the mesial so when you see the distal contact area, it is more cervical. Okay, it is more cervical. We will be able to see it more better in this view, the major view. But let me just tell you that the distal contact area is more cervical than the mesial contact area. And the mesial cusp ridge, this one, it is shorter than the distal cusp ridge. Alright. Coming to the lingual aspect. Here, just remember, as we saw in the maxillary canine, everything, they have the same features over here also in the lingual side, only that everything is less prominent. Okay, everything is less prominent and less developed. Like coming to the cingulum, which gives the convexity to the cervical third, it is less prominent. Alright, it is poorly developed. And then there are the marginal ridges. They are also less prominent as the mesial and distal marginal ridge. And then together the cingulum and the marginal ridges make the lingual fossa, and that is also shallow. Okay, so everything less. Okay, so if you remember one also in the maxillary, so it will be easy to know the features in the lingual side. And one last point, that there is the lingual ridge over here, which divides the lingual fossa into two smaller fossae. Okay, so there's a lingual ridge. Okay, it's there in the maxillary also. Here also there is one lingual ridge. Now, coming to the mesial aspect. Okay, and also just starting point I told, I think I didn't tell, but I have drawn it, that it is trapezium or pentagonal in shape. Okay, both of these like this. And this cervical line is pointing apically in the labial side. Okay, coming to the mesial. So the mesial side, the shape, it is triangular or wedge in shape. And the crown outline, if you see in the labial, it is less convex, and the lingual is less concave because the lingual fossa is shallow. So everything less over here also, as we saw that. And the cervical line is more, it is having more curvature than the distal. That difference is always there. The cervical line, it has more curvature in the mesial side. And as I told, the contact area, so over here it is near the incisal end. Okay, the contact area, it is in the meso-incisal angle. And one point that I want to mention over here, that I think I didn't mention in the maxillary canine, is that the cusp tip, okay, this cusp tip, it is having the position more lingual to the vertical root axis. You know what is the vertical root axis, right? It runs from the root, straight line. So this, it is more lingual. Okay, it is behind, it's lingual. But when you saw in the labial, I think I didn't mention it, but just note it down, that for the maxillary canines, it is more labial. This cusp tip will be here. For the labial, for the maxillary canine, For maxillary canine, the cusp tip is more labeled to the vertical root axis, and for mandibular canine, it is labeled. This is a very, this characteristic feature which you should note down. Alright. And one more point over here, that the difference, okay, the maxillary canine, it had developmental groove in the mesial side also, but it wasn't that deep, it was deeper in the distal side. But over here the difference is that the developmental groove is deeper in the mesial side, and it is more deeper over here in the mesial side. In the maxillary, it was more deeper in the distal, but in the mandible, it is in the mesial side. The DDs are more deeper in the mesial aspect. Okay, coming to the distal, it's all, everything is same. Okay, the label outline is less convex, and the lingual, the fossa is more shallow, and that is what makes a lesser concavity over there. Now, the cervical line is less curved, as I told you, then comparing with the mesial. In the distal, the cervical line is less curved, and the distal contact area is positioned more cervically. It is near the cervical. It's more cervical than the mesial. Mesial, it was more incisal. Distal, it is more cervical, the contact area. Alright, coming to the incisal aspect. The incisal aspect over here, it's oval. In the maxillary canine, okay, so keep comparing, okay. That's how you will learn. So in the maxillary canine, it was like a diamond shape, but over here it is more oval, because everything is less prominent, it's making less cuts and everything, so it is kind of oval over here. And the cingulum is smaller, we know that. Lingual fossa is shallow, cusp ridges are curved lingually, and cusp tip is positioned lingually, right? Over there in maxillary canine, it was labial. Okay. Coming to the root, I think I don't need to make a separate video on the root and the different identification feature as I had done there, because it's quite obvious. Alright, so here we'll just discuss from here only. The root is one, with a single root over here. The pulp canal is single, and the size of the root, it is long root. Okay, it is very long. For canines, they are long roots. And identification features, it is, I'll just tell you that it has a long and narrow crown with sharp cusp. Okay, here the cusps are sharp, and the labial ridge and the cingulum are less prominent. Even coming to the labial ridge, okay, there in the maxillary canine, it was kind of very prominent. It was very bulb, like it was prominent. It was large, it was big. But in the mandibular canine, it is less prominent. Even the cingulum. Okay, so both those lobes are less prominent. The root is long and narrow when viewed proximally, okay, from the side views. The cusp tip is lingual, as I had discussed. This is a very important identification feature that you should know. So we are going to come to the side identifications, that is when you view the tooth proximally, side identification, what do you identify? What are the features that differentiate the permanent mandibular canine from any other tooth? So the distal cusp slope is longer. Alright. So the cusp slope, the distal one, it is longer. I think I told you over here. And this one, it is longer in the mesial cusp slope. And the developmental groove on the mesial, I had discussed, it's deeper on the mesial aspect than on the distal aspect. And labially, the mesial outline is straight and the distal outline is rounded. Okay. Labially, when you see, the mesial outline is straight, distal outline is convex. Alright guys, I think that's all for this one. Just you try to compare, differentiate, as we saw what are the difference between the maxillary and mandible canine. What did we see? First, in the first video we saw that the first 2 points were same. What were the first 2 points? The first, evidence of calcification and everything. The enamel formation completion was the same, okay, the year in the chronology. But when you saw the eruption for maxillary is 11 to 12 years, while for mandible it's 9 to 10 years. And the root completion for maxillary is 13 to 15 years and mandible 12 to 14 years. So you should keep comparing these. Alright, so label is almost same, not much difference. Lingual, everything is less prominent, less developed. The lingual fossa and everything. Okay. And the mesial aspect, when you see the developmental root, so just and this lingual, that the cusp is lingual to the vertical root axis. Alright, so this was something about the permanent mandibular canine, and I hope that you liked this video. I really do. Thank you guys. Thanks for watching the video.